just unmute. Good evening, everybody, and thank you for welcoming us. I'm just really excited to be here and to be sharing and building on what Monica and Sara have already shared. We're a very practical response to the homeless journey for families, and we're based in the northwest of England in Oldham. Shared Health Foundation is a community interest company, and we're philanthropically funded. And Dr. Laura Nielsen heads up our team. We're really passionate about looking at how we reduce the impact of how poverty impacts on health inequalities. Nice. So, I've been a midwife since 1998, and I've always worked in practice in community and antenatal, and have always been really, really passionate about the most vulnerable women that run through our communities, really, in inner city areas. And as I worked over the last decades, I became more and more frustrated, really, at seeing that revolving door around where families came through. And at the beginning of the pandemic, was really blessed to be able to come and work for Shared Health Foundation and to start looking at homeless families. And who would have known that under that umbrella of homeless families are all the most vulnerable women that we care for within our communities. A generation of children being born into a homeless system with little hope of a place to call home. Just some numbers to start with. I know that Sara and Monica have covered some of this, but these are the most up-to-date numbers that we know from July 2024. 159,000 children in temporary accommodation across the UK. And when we started in 2020, that was around 127,000. So just in the last 3 or 4 years, we can see the numbers increasing. And as Sara said before, it's really difficult for those hidden numbers to be seen. So we know that there's around 20,000 babies being born into temporary accommodation, but I really don't think that's accurate. And as we've said, women being afraid to report and to register as homeless, sofa surfing with overcrowded families. So the numbers are probably not correct. But what we've also realised in the work of Shared Health is that if it's not being recorded, then who is interested? And this has been part of our journey as we've built the project and the response on the ground. So the sister company to Shared Health is Focus Care, and this is a model of care that we have run for over a decade in Greater Manchester and across in Dublin and Brighton. And Focus Care is embedded within GP practices, and we look at making the invisible visible within the general population. We're evidence-based, and we know that we talk to the doctors in those GP practices about those heart drop patients. And then what we do is we try to come alongside those patients and look to improve their health outcomes, access to universal screening, access to correct pathways for medication, all of those different areas where we know that barriers exist for the most vulnerable. So we adapted Focus Care, and we started to look at what that would look like for homeless families as we started to work and see how many children were being placed in mixed accommodation, in B&Bs. We knew that there needed to be a different response, a response that looked at how health was impacted, how the barriers to accessing health through the system of homelessness could be made easier for the most vulnerable within our communities. And that's where our project for homeless families came about. Around the same time as we came out of the first lockdown, we were approached by NHS Properties, and this gave the perfect opportunity to pilot the crib. In the original days, we were called the Healthy Gems Hub, and this partnership was to use unused spaces within the NHS to look at providing services and working alongside, in partnership, multidisciplinary, to provide what they called a social prescribing response. So we looked at Focus Care, working alongside families, embedded within local authority, and we started to see how we could implement Focus Care to walk with families through the journey of being placed in emergency accommodation right the way through to a tenancy. For some, temporary accommodation is between 6 and 9 months, but for many, it can be anywhere above a year. We've seen families that are still placed in temporary accommodation 5 years in. So this space allowed us to invite families when we've talked previously about families being in one room, not having play space, not being able to access somewhere to clean their clothes or use a washing machine. And so this space allowed us to be able to welcome those families and do really bespoke work with them, and to look for those windows of opportunity, to look upstream so that we could mitigate all of the impact of those adverse experiences for those families, but also the homeless journey, and really look to remove those barriers and help them to improve the situations in which they were living. The space offered us the ability to run a baby bank, so we could respond to real practical need and crisis. Often we know that families need that therapeutic relationship. They need to know that they're cared for before they will start to trust and let you into the other aspects of what's going on in their lives. It also allowed us to be able to host other services that offered restorative courses, for example, courses around domestic violence, courses around teenage behaviour, courses around baby bonding. So it allowed us to facilitate a space that we could welcome families, but then also welcome other services to work with us to remove those barriers. We were very blessed that we had a room that we could use for therapy. And as we all know, there are many delays in getting families and individuals into therapy. But what we saw was, with the ability to just hold them in that space, they were able to make the next right decision. Many of our families and our women didn't have that person that they could go to for that advice that is really directing them to the next right decision. Often they would need somebody just to hold them in that space. And so as we did that, and as we found that space for women, we were then able to help them make decisions around sexual health, around family planning. Again, all of these services were difficult to access. And again, we've referred to that previous speakers around GP access, accessing to get implants, accessing to get children up to date with their immunisations, long-term conditions. We saw all of these gaps, and we were able to step in and provide them in an actual building. We looked towards doing a step-by-step approach to reduce those inequalities for families. What we knew is, like we said, without that relationship, without that trust, there was so much worry and concern about whether their children would be removed. So as we started with that crisis provision, it was really important, we found, in the response of families and the response of women, to actually then making that comment as they left. Oh, I've just got this lump here. Oh, could you help me with this? After we'd made that initial connect. And because we were based below the medical practice, it was a really easy route then to be able to take women if there was need for them to have appointments or to be registered. We also put them at the centre. We do a household approach. So we put them at the centre of the decision making, hoping to empower them, that there is hope for the future. But what we know is, when housing is unstable and not safe, when we know we don't have a place to call home, it's very difficult then to set goals and the future and look to what can come. So we find often hopelessness is something that is really embedded within our families. And so that journey of trusting and being with them on the journey, from the emergency accommodation where they can't cook, they can't rest in a separate room to the children or the baby, to be able to just come alongside them and be able to walk that journey and offer solutions, practical solutions, became really important. Just a little as to why we were called the Crib. We were originally called the Healthy Gems Hub, and with the commissioning of the family hubs, it became really confusing. We are really small, as a community interest company, philanthropically funded, as I've said. And so we needed to just make sure that confusion for professionals and multi-agency working was removed. I am a little bit old, so I remember MTV and Pimp My Crib. But the Urban Dictionary definition of that is a house or a dwelling where one lives in their neighbourhood. And I quite like that, alongside the work that we've been doing to create system change and also look at safer sleep, which we'll go on to in a little bit. So that's just why the Crib. Some people love it, some people hate it. A little snapshot of some of the work that we've been doing. So we have We've seen over 400 families since we've established. Obviously, there's been a lot of work to work alongside local authority and to bring a health perspective for the first time, I feel, to the way in which housing looks at their families within their care. Many of the actions that focus care we do as focus care practitioners is to look at that registry with GP practice, sexual health, as we've said. But we started to see lots of women who were pregnant, who didn't have access, who weren't able because they'd been moved or they'd fled domestic violence, or because they had been moved 3 or 4 times out of borough because they needed to find they just had no control. And so I think many people don't realise that there's absolutely no control for these families as to where they are placed, and that impacts on all of the different services and health access that they're able to go to and access. Some numbers just on some of the practical provisions that we've given. Infant formula, and again, we follow guidance around that. A wider context, optimum nutrition, vitamin D, but also looking at babies under the age of stage 1 formula to ensure that they are covered. And just to ensure as well that when we know, if we think in the wider context of families having to access food banks, many food banks, so absolutely no provision for babies and children, and they give absolutely you have had to reduce the scoops, have had to make a decision on whether or not that room is warm or that baby there's one less scoop to make that milk last a little bit longer. Safer sleep guidance, we'll talk about that a little bit more, but every cot and Moses basket, what we started to realise from the earliest days of the provisions we were giving through Baby Bank was because of the financial hardship, women didn't and families didn't have the opportunity to make that decision around safer sleep. And even if they did, sometimes they didn't want to place their baby in that cot because they feared that it was dirty or not clean. So there was lots of parts of the puzzle that we were starting to unpick that we needed to look at. And this is some of the response that we've made in the time that we've been established. Sara and Monica have touched on some of these. So the themes that are continuous that we see throughout the journey, and that is preconception, antenatal delivery and postnatal, missed confirmation of pregnancy. Again, if you are in the homeless journey, you're seen as priority if you're pregnant, but if nobody has confirmed that for you, then quite often that's not accepted. Or in the early days of the pandemic, that's where we found ourselves. Missed booking appointments, which then had a knock-on effect to screening and then scans, saving babies' lives. All of these different vital components of the maternity journey were missed or were delayed at different points, and we see this time and time again. Access to hospital, being moved just before delivery. I think Sara mentioned about being moved at 37 weeks, 38 weeks, when every mother just wants to nurture and just make sure that they're nesting and they're ready and they're prepared. And then within 4 hours, we've had women who have been moved out of borough. Uncertainty around the new location, not being able to access. And again, we see those women that are in households where they are lone females with other children, where there is no childcare support. Where do you place those children when you are going into labour? What we see time and time again is the safeguarding issues around who those children are left with. And often in that situation, women will make the least worrying move to leave children. We've had women leave children with the woman in the next room because she was nice to me, or a woman that I met in the shop across the road because she was kind. So again, the safeguarding, will my children be taken away? All of these barriers, all of these problems surface time and time again. And in the postnatal period, we've had women discharged to a bed for every night, women discharged to hotels with no phone, no contacts. We've had women who have been, the discharge process has not been followed. Poor standards of accommodation, hot radiators, that regulation of the temperature in the room is nigh on impossible because that's regulated by the building that they're placed in, missed PKUs, missed weights, babies and observations, breastfeeding interrupted because they're not allowed support and not allowed people to visit or stay with them. So isolation, feeling of being alone in that new environment as a new mum, not having anybody to stand with them and to just prepare food for them. There's nowhere to store food. There's nowhere to cook food. All of these issues impact our ladies all the time. And we have to navigate that with them each and every time they're discharged from hospital. I thought that I would share a little case study, and I hope you can see this picture because it's a prime little example of what happened at Christmas. So this family was not on my caseload. They were out of area, but the midwife who had been seeing this lady antenatally knew that I ran a baby bank and knew that she didn't have any Moses baskets. So I got the call and went in and provided the items that they needed under financial hardship. Their country of origin was Mauritius, first language Creole, limited English, but a good level of English mum had. And it's just to highlight what happened to them. So in the week before delivery, they were in a second floor flat, and they were moved a week before delivery up to the third floor flat in the same building. For what reason, we are not sure. She then went into hospital and delivered by cesarean section. She was discharged from hospital day one with these low birth weight twins that you can see just on the side here. On the day that she delivered, the local authority decided to change her temporary accommodation. And they changed it to what I would suggest is equivalent to an Airbnb in the countryside, beautiful fireplace, spiral staircase. But first day home after delivery, cesarean section with twin babies, this is where the family were placed. So Dad had to leave the hospital, move all of their belongings with their 3-year-old, and then take his wife and babies home. 2 buses to the nearest town or the nearest GP. And then when she'd phoned me, like I say, she wasn't on my caseload, but when she phoned me, I arranged to go and meet her on the Monday. On the Monday when I got there, she hadn't been visited. It was day 8, and she hadn't been visited because the new accommodation, the new temporary accommodation, was out of borough to where she'd actually delivered. So these babies hadn't been seen. So it then took over an hour to try and locate where we needed to get through to the numbers to try and get this lady seen. On the day that they visited was day 9, the following day. And one of the twins was admitted with neonatal jaundice. And mum and babies had to go back in. Breastfeeding was disrupted. This lady was a really competent mum. She was really on the ball with things, and she's a lovely lady. But she said that she felt like one of her babies could have died. Her experience of that will stay with her in her testimony, and we're following that through. So that process of discharge wasn't followed. She did have the same phone number. The midwife had gone out, had gone to the other address, and then in that had told her that they had been moved, and that's where communication broke down. And I've just put the embrace there. We know NICE guidelines. We know that not much has changed over the last few years. We know that women being seen early, good communication, women put central to their cares and concerns, the right specialist pathways to be followed, language, communication. They're all the things here that obviously for this family, the babies are doing well and they're putting on weight. But mum has had an experience there which we hope won't happen again for others. I've just placed quickly up here. So if you ever get to come and see us in person, we often do this just as a bit of an icebreaker for individuals to look at. And we call it Badger or Baby. And it's basically to just talk through the fact that how do we change systems? And what we know is, ironically, the notes that women have are called badger notes. And what we see in law is that legislation covers badgers more than it covers babies. So babies can be moved at any point in pregnancy, but badgers, if mother is pregnant, they can't be moved. And so it's just to highlight, and the slides you'll have later, but it's just to show how there is more work to do, and how do we change the system? And you can have a read of that. This last slide is just to show the process by which, with with Safer Sleep, how we worked through to the All Parliamentary Political Group, how we worked with the NCMD, how we looked to raise awareness, politicians championing, working to champion our families. And the process is long and hard, but actually what we have now is embrace recording where babies are when they pass. We do now look at NCMD to look at the numbers of and the related causes of death, and that's where the latest figures have come from. We do have a growing body of evidence, and we do have a growing number of politicians and MPs that are supporting the work that we do. And last year, at April 24, Amnesty International took on the call and created this resource, which you can click on after if you would like to raise awareness. Attention is growing. Homeless families are on the agenda. As we move forward, we know that we can improve things for families and for babies and women as they pass through the journey of homelessness. Thank you for your time.